It's Medicosis Perfectionalis, where medicine makes perfect sense. We continue our endocrinology playlist, and today it's time for the histology of these doozy endocrine glands. But first, let's answer the question of the previous video. 5-year-old girl is brought to you by her parents because of a neck swelling. On physical exam, there is a right-sided cystic mass along the anterior border of the right sternocleidomastoid. So first, this is not a midline lesion. This is to the right side, and it's along the anterior border of the right sternocleidomastoid. This mass does not move up or down during swallowing, and there is no visible opening on the skin surface above the mass. So what's the most likely diagnosis? Thyroglossal duct is not the answer. Thyroglossal duct cyst is not the answer, because these are midline structures. And of course, they will move with swallowing or with protrusion of the tongue. Lingual thyroid is in the mouth and it's a midline structure. Thymoma is in the thorax, not in the neck. Aberrant thyroid is also in the thorax, not in the neck. Lateral cervical cyst is the correct answer. You can call it lateral cervical cyst, branchial cyst, pharyngeal cyst, lateral pharyngeal cyst, etc. And the description is classic: right-sided or left-sided. Anterior border of the sternocleidomastoid does not move up or down during swallowing, does not move when you protrude your tongue, and there is no visible opening to the skin surface. It's not a freaking fistula. So let's compare among 4 different lesions. Number 1, dermoid cyst. Number 2, you can call it pharyngeal cleft cyst, branchial cleft cyst, lateral cervical cyst, etc. Number 3, thyroglossal duct cyst. Number 4, accessory thyroid tissue. Dermoid cyst, tell me about it. It's a cystic teratoma. That's the pathology. That's the histopathology of it. Where do you find it? Lateral aspect of the eyebrow. That's in the head. Not the neck, not the thorax. Pharyngeal cleft cyst or branchial cleft cyst or lateral cervical cyst are the remnants of the cervical sinus, and this is not a midline structure, this is a lateral structure. You find it at the anterior border of the sternocleidomastoid. Thyroglossal duct cyst, this is a remnant of the thyroglossal duct. It's just a duct that happened to have a cyst in it. And of course, a cyst is like a freaking sack. And where do you find it? Between the tongue and the thyroid. This is a midline structure. This one is a lateral structure in the neck. This is a lateral structure in the head. Last, accessory thyroid tissue, usually between the tongue and the thyroid, because this was the descending path of the thyroid. From the tongue, specifically the foramen cecum, all the way down to the front of your neck. Therefore, it has to be a midline structure. There is a big difference between the word brachial and the word branchial. Brachial in Latin means the arm. Oh, and that's why we have brachial artery, brachial vein, brachial plexus, etc. Branchial is referring to the fish, because this structure in the fish will give you the gills. But in human beings, it does not give you gills. It does not even give you lungs, as we have discussed before. And as you know, we have branchial pouches, branchial arches, and branchial grooves. You can say branchial or pharyngeal. Pharyngeal is preferable, but I don't care. Some definitions, please. Autocrine, paracrine, endocrine. What's the difference among them? Okay, autocrine, what does the word auto mean? What's an automatic transmission? Auto means self. Okay, the cell secretes a chemical that's gonna act on the same freaking self. Okay, I get it. Paracrine, the word para means parallel. The cell is gonna secrete something that's gonna work parallel to the cell. It's gonna work in the extracellular fluid in the local tissue, just around the cell in this teeny tiny area. Endocrine, however, the word endo means within. This is your bloodstream. This is a cell that does not have a duct. It just dumps the secretion into the blood or lymph, and the blood will take it places that are distant from that location. So autocrine on the same cell. Paracrine is local, endocrine is global. For example, the pituitary gland secretes ACTH, and this is secreted in your freaking brain. But then it's gonna reach your adrenal gland. And your adrenal gland, of course, is an abdominal structure. Yup, it's global, baby. If you remember my autonomic physiology series, we have talked about nervous stimulation. Of course, you know there is a neuron secreting a neurotransmitter. It could be acetylcholine, norepinephrine, etc. Neurocrine. This is when a neuron secretes a hormone. How about cytokine? Cytokines are a generalized term like this. Here are cytokines. These are your cytokines. Within the cytokines, there is a smaller category known as the interleukin. Basically, the story goes like this. When you do not know the function, you just call them cytokines. As freaking science advances and then you discover their function, you will call them interleukin and give them a number. Example, interleukin 1, interleukin 2, interleukin 6, etc. All of these are what? These are interleukins. And they are part of what? Of cytokines. So I can call this interleukin 1 or I can call it a cytokine. Both are true. But hey, medicosis, why did you call them cytokine? The word cyto means cell, kine from kinetic, movement. Oh, these are structures that are gonna influence the cell. Got it. And why the flip did we call them interleukin? What does the word inter mean? It means between. And what does the word leukin mean? Leukin means, first, IN, usually a protein. Leuc are the leukocytes, white blood cells. So interleukins are the internet of the white blood cells. This is how your white blood cells communicate with each other. It's their www.interleukin.com. And last we have gap junction or nexus. The endocrine glands that we will talk about, as you know, we have hypothalamus-pituitary, and then 3 glands that listen to the pituitary, and 3 glands that do not give a rip about the pituitary. The 3 glands that obey are thyroid, adrenal cortex, and gonads. 3 glands that do not care are parathyroid, adrenal medulla, and pancreas. Any gland has stroma and parenchyma. Oh, I don't understand. I don't get it. Look, my friend, the stroma is the bed. The parenchyma are the cells on top of the bed. Oh, I still don't get it. Let me give you a car analogy. Any car has an outer visible structure that you see. Oh, this car looks shabby chic. It looks modern. It looks archaic, whatever. The look is the parenchyma. But underneath this, there is a solid structure known as the chassis or chassis in French. This is the skeleton of the car. On top of that skeleton, you lay the actual freaking car. Same thing in your gland. The skeleton of the gland is known as the stroma. The actual cells of the freaking gland are the parenchyma lying on top of the stroma. Okay, what is that chassis made of, or the stroma? The stroma is the bed, and of course it has no specific function. It just gives a structure, not a function. Okay. And it has a fibrous capsule like this on the outer part of the gland, and then it will extend some trabeculae, and the trabecula will divide the gland into septa. Let's say that this gland is the freaking thyroid. So the stroma of the thyroid has like a beautiful capsule and some trabecula. Wonderful. How about the parenchyma, the actual freaking cell of the thyroid known as thyrocytes, follicular cells. Look at these doozy follicles. These are the parenchyma. These are the cells that actually secrete your thyroglobulin, your T3 and T4. So tell me about the stroma, just the bed. This is a connective tissue matrix. Tell me about the parenchyma, the bulk of the substance, the visceral flesh. In case of the brain, the parenchyma is the neurons and the glial cells. In case of the lung, it's the alveoli. In case of the thyroid, it's the thyrocytes. Now it's time for some medicosis wisdom. Any gland, and I mean any gland, will have stroma, which is connective tissue, which is the skeleton of the gland, and on top of it, you lay the parenchyma. In this type, it's gland, so it's going to be epithelium. What type? Glandular epithelium. Okay, glandular epithelium is gonna secrete those doozy hormones or secretions. We get it. Any cell that's gonna secrete anything has to be a big cell. Why? Because these secretions do not come from scratch. They do not just emerge from the ether. They are secretory granules that have to be stored somewhere. Of course, the cell has to have enough space to store these granules, and that's why squamous cells cannot secrete anything, because there is no space to secrete those doozy secretory granules. And therefore, any gland will have columnar or at least cuboidal epithelium. Forget squamous. Forget it. It ain't gonna happen, baby. Medicine makes so much sense once you understand what the flip you're talking about. Exocrine glands have a duct, so it looks like this. Here is the acinus of the gland, has some doozy glandular epithelium that's going to secrete some secretions, and these will be released into a duct, into a near tissue. Example, if this is your salivary gland, this is the duct of the salivary gland, acinus, and then it will secrete the saliva into your freaking mouth. That's an exocrine gland with a duct. Again, it's all local. However, endocrine glands will dump their secretion into blood or lymph vessels, and therefore endocrine glands are ductless. They do not have a duct. Ductless, remember this. And this reminds me of an old guy sitting at a Starbucks reminiscing about the good old days. Man, back in the day when I was young, people these days. Coffee has become caffeineless, cars are driverless, meat is meatless, churches are godless, sweet is sugarless, thermometers have become mercuryless, and the chicken breast is even skinless. And the endocrine glands are ductless. Now let's talk about the mother of all glands, the leader, the general manager, your doozy, pituitary gland. Why do we call it pituitary? First, the word airy is like easy. This is like an adjective in English, like sanctuary, tributary, pulmonary, etc. So the idea here is the pit. If you remember your anatomy, pit is equivalent to another word called the fovea. Oh, or the fovea. What the flip is this? If you remember the bone, yep. If I have a big indentation in a bone like this, I'll call this what? A fossa. But if this pit is just small like this, I'll call it what? I'll call it a fovea or a pit. And that's why we call it the pituitary, because it actually looks like a freaking spit into the sella turcica. This is exactly right. It's a fovea. This gland is small in size but robust in function. As you know from my previous videos in this endocrine playlist, the pituitary gland is divided into two parts. The anterior pituitary, adenohypophysis, because it secretes stuff, and the posterior pituitary, the neurohypophysis, because it does not secrete squat. It just stores what the hypothalamus secreted. Okay, what did the hypothalamus secrete? Oxytocin or ADH. And these are stored in the and released from the posterior pituitary. Next, let's talk about the anterior pituitary, the adder. That's an actual gland. Secretes almost everything. Growth hormone, prolactin, TSH, ACTH, FSH, and LH. Why did all of them come from the anterior pituitary except these two? The answer was in the previous video. Pituitary gland, anterior pituitary, posterior pituitary. Some doofuses call the anterior pituitary the pars anterior. We divide the anterior pituitary into three parts and the posterior pituitary into three parts. Let's go with the anterior. We have the pars distalis, pars tuberalis, and pars intermedia. The most important one here is your pars distalis. This is the one that secretes the GH, the prolactin, ACTH, TSE, you name it. Okay, let's talk about the posterior pituitary. You have the median eminence, the infundibulum, and the pars nervosa. The biggest and most important part is the pars nervosa. Also, that's why we call them the pituitarides. Pituitary sites, cells over the pituitary. What do they secrete? ADH and oxytocin, but please remember, they did not synthesize the hormones. They just stored them. Who made them? The boss, the hypothalamus. Sites or cells in medicine, we have pituicytes, thyrocytes, erythrocytes, granulocytes, monocytes, lymphocytes, thrombocytes, megakaryocytes, melanocytes, phagocytes, and spongiocytes. You should know all of these. If you have any doubt about any of these, just leave a question in the comment section. Let's talk about the posterior pituitary. It did not make any hormones. Who made the hormones? Hypothalamus. And then they got transferred through these unmyelinated neurons from the hypothalamus to the posterior pituitary. Why are they unmyelinated? Because myelin is freaking expensive. We try to leave the myelin just for the motor fibers because they have to be very fast, especially if you're running from a tiger. Watch my videos on the autonomic nervous system physiology to learn more about myelinated versus unmyelinated. Because we live in a world of scarce resources which have alternative uses. Okay, who's gonna carry these hormones? Something called neurophysin. Neurophysin ends in IN, probably a protein. Yeah, it's a carrier protein, and it carries the hormone on it. Okay, hormone got secreted, and then jumps onto the neurophysin, and then goes from the hypothalamus to the posterior pituitary via some unmyelinated axons. And this part here is called the infundibulum, or the stalk of the pituitary. And then these doozy hormones, ADH and oxytocin, are going to be stored into herring bodies. Don't forget that the infundibulum is a neural structure. It's part of the neurohypophysis, not the adenohypophysis. This is posterior pituitary, baby. Now let's focus on the anterior pituitary, just the anterior. We have cells that are called chromophils, and these are colorful cells. Phils mean, philo means to love. It's like philosophy, the love of Sophia, the love of wisdom. And chromo means colors, and that's why Google Chrome has a very colorful logo. Hey, here's a quick question. Why is Amazon logo like this? We write Amazon, and there is the app. Oh, it's just a smiley face. Yes. It's also telling you that they have everything from A to Z. Man, corporate life sucks. These chromophils are divided into two cells, those who appear pink under the microscope known as the acidophils, and those who appear blue or dark blue under the microscope known as the basophils. Where do you find the acidophils? In the center of the pars anterior. What's the pars anterior? This is the anterior pituitary. Okay, so they are in the center, but the basophils are on the periphery. How do you remember it, medicosis? The B with the P. And then we have other cells that do not stain pink or blue. We call them the chromophobes. Phobe, from phobia, afraid of, color. Chromophils are larger. They have granular cytoplasm, and therefore they will secrete something. Okay. However, the chromophobes are smaller, they have no space, therefore they cannot store any granules, therefore they do not secrete anything. And that's why, whether you're talking about your growth hormone, prolactin, TSH, ACTH, FSH, LH, all of them come from chromophils and not from chromophobes. Let's get more specific about the anterior pituitary. We have acidophils and basophils. Acidophils are going to secrete growth hormone and prolactin only. Basophils will secrete all the others, TSH, ACTH, FSH, and LH, collectively known as gonadotropins. Why do they end in IN? Because they are freaking peptides or proteins or whatever. Why gonado? Because they will influence your gonads, the ovaries and the testicles. Why trope? Because the word trope means growth. Gonadotropin. Every piece of the word has a meaning, you freaking doofus. Physiology just doesn't make sense. No, it makes perfect sense if you understand what the flip you're talking about. Now let's get more specific. The acidophils that are going to secrete the growth hormone are known as somatotrophs. Why? Because growth hormone is also known as somatotropin. The acidophils that will secrete prolactin are known as lactotrophs. Why? Because this is pro-lactation. We can also call them mammotrophs because it's gonna influence the mammillary glands. Next, the basophils that are going to secrete the TSH, this is called thyrotropin, are called thyrotrophs. Thyro, because they will influence the thyroid gland. Trophs, from growth. Because when the thyroid gland receives the thyrotropin, it just blushes and grows and matures and ceases being as naive as the B lymphocyte before it recognizes the antigen. Next, the ACTH, also known as corticotropin, released by corticotrophs. How about FSH and LH, collectively known as gonadotropins, are released by gonadotrophs. Gonadotrophs and lactotrophs are acidophils, thyrotrophs, corticotrophs, gonadotrophs are basophils. Next, let's talk about your thyroid gland and the 4 parathyroid glands. Okay, thyroid has 2 main cells. Follicular cells, you see, the one in the middle is called the freaking follicle. Okay, I'm with you. And then the cells that are around the freaking follicle are called follicular cells. Perfect. What's in the follicle, medicosis? Something called colloid, which is thyroglobulin, which is a freaking protein. Okay, perfect. How about those cells that are parallel to the follicles? We call them parafollicular. We can also call them C cells. Why C cells? Because they will secrete calcitonin. Perfect. How about those follicular cells? They will secrete 3 things: the thyroglobulin, the T3, and the T4. Mainly the T4. That's why this is known as thyroxine or thyroid hormone. We secrete lots of T4, but not so much T3. Next, the parathyroid glands, which are on the posterior aspect of the thyroid gland. Again, parathyroid has 2 main cells. Chief cells, also known as principal cells, and principal with a P will secrete PTH or parathyroid hormone with a P. And of course, these are more numerous because they are the chief cells. And we have some oxyphil cells, less numerous. We have no idea what the flip they're doing, but they are associated with aging. The older you get, the more oxyphils will develop in your gland, which makes perfect sense to me, because as you grow older, your life becomes like a country song where everything that could go wrong will. But if you are young and tender like me, your life is like a country song in reverse. Then you get your wife back and your house back. As you grow older, your chief cells will deteriorate, and then the rest of the gland will be filled with some oxyphil cells. What does the word oxy mean? Acidic, and that's why we have oxyntic cells in your stomach, aka parietal cells, because they secrete the freaking acid. As we have discussed before, we have adrenal cortex and adrenal medulla. Adrenal cortex came from the mesoderm. Adrenal medulla came from the neural crest, which is part of the ectoderm. The adrenal medulla, which is here in the core of the gland, has chromaffin cells. Why do they call them chromaffin? Because they have great affinity for chrome stains, and chromes are colorful. Adrenal cortex has 3 layers: zona granulosa, zona fasciculata, zona reticularis, or GFR, or as some nice person told me in the comment section, the deeper you go, the sweeter it gets. Here it is salty. Here it is some steroids, okay, some sugar, but here it is adrenal androgens, sex, baby. The fasciculata is the thickest zona. It's vacuolated, no wonder, because it's filled with spongocytes. These are spongy because they secrete steroid hormones. They are fatty, greasy, oily, just like your stool when you have a malabsorption syndrome. Adrenal medulla, let's sing the song. Phenylalanine, tyrosine, dopa, dopamine, noradrenaline, adrenaline. The adrenal medulla contains something called APUD cells. What the flip is this? Amine, precursor, uptake, and decarboxylation. What the F is that? Easy, my friend, it's the same song. What did I say? You said amine, okay, precursor, uptake, and decarboxylation. Amine, you have dopamine, norepinephrine, epinephrine. You know what we call this? We call them catecholamines, amines, okay. Precursor, yeah, because we started from their precursors, phenylalanine, tyrosine, etc. Uptake, yeah, because the gland will uptake the phenylalanine, tyrosine, etc. Why decarboxylation? Because look at the name of this enzyme. It's called the dopa decarboxylase, you freaking doofus. It's uptake and decarboxylation of those amines to make catecholamines. Love it. Your pancreas has an exocrine part and an endocrine part. Let's just focus on the endocrine part. Ductless. These cells will just dump their secretions into the bloodstream. We have 3 endocrine cells in the pancreas. We call these the islets of Langerhans. We have alpha cells, beta cells, and delta cells. Which ones are the most important? The beta cells, because they secrete insulin. Okay, so let's put them in the center because they are central to the pancreas function. Okay, alright, fine. And then on the periphery, we have alpha cells. They secrete glucagon. And then interspersed between them are the somatostatin-secreting delta cells. If you want to learn endocrinology right, please check out my playlist known as Biochemistry and Genetics on this great channel, Medicosis Perfectionalis. And please remember, only GLUT4 is insulin dependent. Hey Medicosis, why is insulin secreted? It is secreted when you eat carbohydrate because carbohydrates contain glucose, and insulin will take the glucose by its hand and then ram it into the cells so that the cells can metabolize it via glycolysis, Krebs cycle, electron transport chain, etc. Okay, perfect. How do I release insulin? Of course, you release it from the pancreas by this process. But first, is this from the exocrine pancreas or endocrine pancreas? Endocrine pancreas. Is insulin released from alpha cells, beta cells, or delta cells? It's released from the beta cells, the central cells. Because insulin is way more important than glucagon. Ask any patient with diabetes. Okay, alright, so insulin is going to be secreted when I eat carbs. Okay, here is glucose. Glucose will enter into the pancreatic cell. Okay, so you're trying to say that the pancreas has a sensor for glucose? Yes, indeed. And that's why the pancreas does not need the pituitary. Pancreas is one of the 3 glands that did not obey the pituitary. The pancreas has its own sensor. Okay, glucose, come here into the beta cell of the pancreas. Wonderful. And then G6P, what's this? Glucose 6-phosphate. Why convert glucose into glucose 6-phosphatase? Because if you leave glucose alone, glucose is going to enter and it's going to go back. Oh, like what the flip? So in order to fix it, you need to phosphorylate it. Okay, glucose, stay here in the form of G6P, glucose 6-phosphate. And then glycolysis will give you what? ATP. This will increase the ATP to ADP ratio. Okay, when you have tons of ATP, they will close the potassium channels. Shut it down. Now, potassium cannot leave the cell because the channel is closed. Potassium is going to stay in. As you know, potassium is positive. Whenever something positive stays in the cell, this is called depolarization. And depolarization equals activation of what? Of calcium channels. Calcium, come here in. And of course, calcium is the hero of contraction. Let's contract this insulin vesicle, squeeze it to release all of the insulin from within, and then we'll dump it straight into the bloodstream because this is endocrine. This beta cell is ductless. Let's talk about hormone-secreting cells. We have 2 types. We have the entire gland, case in point, the thyroid gland. The entire freaking gland is a hormone-secreting gland. Okay, perfect. How about some other cells just within a gland? So the gland is not entirely endocrine. It's just some cells of the gland. Case in point, kidney. Does the kidney have endocrine function? Yup, it does. So what is the endocrine function of the kidney? Please let me know the answer in the comment section. The pancreas, yeah, because most of the pancreas is exocrine. Just some cells within the pancreas are endocrine. The gonads, yeah, the main function of your ovaries and your testicles is to make ova and sperms respectively. That's the main function. In addition to this, they have some endocrine cells to secrete estrogen and progesterone in females and testosterone and dihydrotestosterone in males. The GI tract, your gastrointestinal tract, they have neuroendocrine system. Some pearls for the pros. As you grow older, your life becomes like a country song. Fatty infiltration of the parathyroid gland is common, and that's why you will see less of the chief cells and more of the oxyphil cells. Let me leave you with the question of the day. Please enumerate each endocrine gland that we have talked about today and tell me about its secretion. So tell me about the pituitary, the thyroid, the parathyroid, the pancreas, the adrenal cortex, the adrenal medulla, the kidney, the gonads, and please do not forget the pineal gland. When are you ever going to take control of your life and learn cardiac pharmacology like a boss? You can learn about anti-hyperlipidemics, anti-arrhythmics, anti-anginal medications, antihypertensives, diuretics, antidigoxin, and much more. Go to medicosisperfectionalis.com and download my premium cardiac pharmacology course. You download it once and you keep it for you forever. And now you can get a 40% discount towards anything on my website. Just use promo code 40OFF, available for the next 20 students only. Thank you for watching. Please subscribe, hit the bell, and click on the join button. You can support me here or here. Go to my website to download my courses. May your life always be like a country song in reverse. As always, be safe, stay happy, study hard. This is Medicosis Perfectionalis, where medicine makes perfect sense.